Hey, what's up? Dr. Chad. Another muscle that is highly implicated in low back pain is called the psoas, more commonly known as the hip flexor. This muscle actually attaches to the spine. It starts kind of up in the mid back and tapers down into the low back a little bit, and then it actually comes through the front of the hip and attaches to your hip. It's responsible for raising your hip up and responsible for allowing your hip to get behind you. So typically we would work on this with like a kettlebell and sink deep into the abdomen. But for the sake of being able to handle this at home, no matter who you are or where you are, we're gonna go after it a little differently with the alpha ball. Because we know where it comes from and where it goes, we know it gets exposed a little bit right here as it crosses the hip. And so if you find this bone right in the front of your hip, it's called the ASIS, and go just inside of that. So it's gonna feel like it's on your lower abdomen, maybe getting down into the hip a little bit. We're gonna take some pressure there, laying on your stomach. So find the bony spot, go just inside. You should feel that it's kind of tucked under that front edge of your pelvis, and as typical, it's a little uncomfortable. Once you get there, spend a little time doing some deep breathing, allowing that ball to sink in and kind of rest into a position where you can start to get comfortable doing some work. And then once you're here, you're gonna do a couple of things. We're gonna press your toe down into the floor and then relax. You're gonna press in, you're gonna hold for 5, 4, 3, 2, 1, relax for 10. You're gonna go through a couple cycles there, and then you're gonna raise the leg up. And you're just gonna try these tiny little motions that puts a lot of force through there. And so you have to be easy with it. You're the boss. If it hurts too much, that's your fault. So just back off a bit and try to minimize things down to a tolerable level. Once you go through the contract relax sequence and 10 leg lifts, you can go ahead and come off of there. And ideally, you're gonna be experiencing less pain. See you later.